If they don't like the deal, they can go somewhere else. You know what? I just don't care anymore. No, that's ridiculous. No, we're not going to do that. No. Oh, my chest is starting to hurt.
Are you okay? Are you okay? You, have the manager call 911, see if they have an AED. If they do, bring it back.
Welcome to the American Heart Association's CPR AED course. Before we get started, let's define a couple of terms that you'll hear used during the course. For the purposes of this course, an adult is anyone who is going through or who has already gone through puberty. If there's any question about whether or not the person has reached puberty, treat the person as you would an adult. Someone who responds, moves, speaks, blinks, or otherwise reacts when you tap him and ask if he's okay. When you push on the chest during CPR, that's called a compression. When someone's heart stops beating, blood stops flowing through the body. CPR can help keep a person's blood flowing until other medical care can be given. The most important part of CPR is pushing hard and fast on the chest when you give compressions. When you push on the chest, you pump blood to the brain and heart. So let's focus just on compressions right now and take a look at how they should be done. Move clothes out of the way. Put the heel of one hand on the lower half of the breastbone. Put the heel of your other hand on top of the first hand. Push straight down at least 2 inches with each compression. After each compression, let the chest come back up to its normal position. This lets blood flow back into the chest. You'll need to give compressions at the rate of at least 100 per minute. So, let's practice giving compressions. For now, we just want to work on doing a good job of giving compressions. Now this means you'll be doing more compressions in a row for this practice than you would for a regular cycle of CPR. You see, we want to focus first on the most important part of CPR, giving compressions. Then we'll add other things you can do to help someone who needs CPR. We're going to pause the video now to allow you to get into position to practice. And throughout the course today, you'll be taking turns practicing, can stay in position when finished. For this practice, you should be kneeling next to the mannequin so you can watch the video as you go. You should be kneeling next to the mannequin, which should be lying on a firm, flat surface. Follow along with the video as it shows you what to do. Get ready and begin. Put the heel of one hand on the lower half of the breastbone. Then put the heel of your other hand on top of the first hand. When I tell you, push straight down on the mannequin's chest. Remember to push hard and push fast. After each compression, let the chest come back up to its normal position. Get ready and begin. Push hard and fast. Try to keep time with the beat until the drum beat stops. When you push, make sure the mannequin's chest moves down at least 2 inches with every compression. After each compression, let the chest come back up to its normal position. Continue to compress at the rate of at least 100 beats per minute.